Good morning, good afternoon, and good evening. First of all, I would like to thank the organizing committee of the PallCHASE webinar for allowing me to present challenges and barriers of Myanmar palliative care journey. I'm Dr. Wawan Nyinsu. I'm radiation oncologist and palliative care clinician from Myanmar. In Myanmar, our total population is 54 million. However, the number of oncologists in the whole country is less than 100, and there is no full-time palliative care clinician in the country. So for me, I'm radiation oncologist and doing the double workload to practice palliative care. The level of palliative care is 3A. That means that we give isolated palliative care provision. And however, the rates of adults in need of palliative care in our country is 69 to 145 per 100,000, and the rates of adults in need of palliative care in end-of-life care is 234 to 353 per 100,000, and the morphine equivalent is less than 0.01 milligram per capita. So these data show that how much we need palliative care. This is the number of patients attending the palliative care OPD from the start of our palliative care service in 2015 August to the 2022. So we all know that cancer has not only the physical burden, it has a multidimensional burden, and our palliative care is for caring of that vulnerable people to give the value-added compassionate-based palliative care. So in addition to the cancer patient, during the pandemic time, COVID is a big issue to every people in the world. So during the pandemic wave, although palliative care is very new in our country, we participated in the COVID management in the hospital and also in the COVID center. So the availability and accessibility of the pain medication and essential medicine for palliative care is vital to the palliative care service. In our country, for the pain medication, there is a government FOC supply of pain medication like codeine, tramadol, and morphine. Although it is an irregular supply or in a degrade, it is very and or sometimes the patient has to use out of pocket to buy those medication, and sometimes there will be the donors who are donated to come and donate for the medication. So our palliative care group is we have as a social support program. We find the donors so that they donate the expensive pain medication or for those patients who are very poor to buy their medication for themselves. So, and for the holistic approach of palliative care, we need the psychosocial care and the spiritual care approach. So during the COVID time, with the help of the Patoma Cancer and COVID-19 support group, we have done online service and also the online training program to the volunteers, and also the spiritual health talks, how to deal with that difficult time, challenging time. And as a self-care program, we also arrange the online Zumba and yoga, and for the healthcare professional and to our volunteers, and also for the cancer patient, with the help of the art therapist, we arrange expressive art therapy, both face-to-face and online program. So this is for implementation of this holistic approach, education is very important. So for that education, since 2017, we did have a stakeholders meeting to integrate the palliative care in the undergraduate medical and nursing curriculum. Due to that policy and the hard work of the palliative care, our palliative care can be included into the integrated curriculum for the undergraduate medical education for 30 hours in year 4. So in addition to the curricular involvement, we also aim towards the training trainees program. So with the help of the AP from 2013 to 2019, the 29 healthcare professionals, and among them 17 professionals are trained in the clinical attachment program. However, very limited people can practice palliative care due to the no career ladder and the no organization setup, and also they are moved to the other department, so that very limited people are practicing palliative care. So now I encourage the junior colleagues and those who are interested in palliative care from both government and the non-government or non-government area to attend the online fellowship program from the Institute of Palliative Medicine, Kerala, India, and St. Christopher Hospice. And also, with the help of that online CME phone apps, we have a very good opportunity to share the essence of palliative care through that phone apps. So in the challenging time, and to overcome these challenges and to develop the palliative care in our country, we need a leadership skill. So I'm very glad to be chosen by the American Society of Clinical Oncology to attend the Asia Pacific Leadership Development Program for 1 year. So the program is completed now, and we hope to implement our HOPE project. So these are some of the organizations we are working, helping us to support our service development, policy development, education development, and availability of the and donation of medication and equipment. And for the public participation, we celebrated the War Hospice Palliative Care Day at the Ulaton Hospice Cancer Foundation as a collaborated event. This year, we launched the HOPE project, helping oncology patients and families at the end of life. Sorry. And this is the door gift we distributed during the events. And however, to have a sustainable development of the palliative care throughout the country, and we have a lot of challenges and barriers, like the barriers from the healthcare system, the barriers in the healthcare professional and healthcare system and healthcare professional, barriers in the patient and family, barriers in the treatment method, and barriers in the culture issue, ritual issue, and also a political issue. So to face that challenges and barriers, we have many conflicts. So there are different types of conflicts. And while we are searching the literature, we can find there are some strategies to overcome this conflict, like we have to accept the conflict and accept the responsibility, and we have to work together and to analyze that conflict, etc. So I think to overcome these challenges and barriers, we have to analyze our circle of control and circle of influence and circle of concern. And also we need to analyze the SWOT analysis, like we have to analyze what are our strength point, weak point, opportunity, and threat point, and also a past analysis of past, like the political, economical, social, technology, environment, and legal. So to develop palliative care in a resource-limited country, we need a community participation, and we need stakeholder supports with the compassionate actions, and we have to nurture ourselves to develop the resilience. So let me conclude my presentation with a famous or words from the movie of Everything, Everywhere, All at Once. So I think that we all know about that movie now. It got many awards from the Movie Association. And from that movie, it is said that be kind when you don't know what is going on. So thank you so much.